Well, good morning, everyone. First of all, I want to say thank you so much for taking time to be with us today. We know that you could be doing other things, and we are very grateful that you chose to be with us. Before we get started on the presentation, I want to make sure that everyone is comfortable. Over here, we have some refreshments. We have coffee, we have water, some light refreshments. If you haven't already, or if you want some more, please go get some. Down the hallway, down this hallway to the right is the men's restroom, and to the left is the ladies. So now that we got that out of the way, let's go ahead and dive into why we're here today. I'd love to introduce myself. My name is Leanne Black, and I'm a Medicare insurance broker. I like to call myself a Medicare advocate for people. And I have the honor and the privilege of being able to be here today to represent United Healthcare. We're going to be talking about some specific things about United. I want you to know that I am licensed. I've been working with United since 2015. And as we see here, I am licensed to sell Medicare Advantage, dual special needs, which means that someone has Medicare and Medicaid, chronic special needs plans, meaning that someone has diabetes and or heart conditions that qualify them for a special plan, Medicare supplement, and also prescription drug plans. I'd like to share with you why I'm doing this, because anybody that's licensed could enroll you in a plan, right? But not everybody understands the healthcare journey. I've been in the healthcare business for 30 years, and I will tell you how I got started was kind of bumpy. At 19, I was 19. My mother was 42. She had a massive stroke. With that stroke, she wasn't able to walk or talk, so she had to rehab back. And that took a long time. So for 30 years on and off, I was her caregiver. After that, I went to work for Hospice of the Valley. Well, during that time, actually, I went to work for Hospice of the Valley, was there for 14 years, so got to learn that side of care. And I left there and I became the patient experience director for Arizona for Optum Primary Care. And that's where I learned about Medicare. And that's when I decided to go ahead and leave corporate America and to do this. In front of you, I have my bio. If you want more information, I have that. But I want to walk through our time together, because if you want to talk with me afterwards, I'll certainly be here. But if you would like to do something more one-on-one, either phone call or set an appointment, one of the things that we need is a permission to call slip from you in order for me to be able to call you. That's keeping us in Medicare compliance, and we all want to make sure that we're compliant with Medicare. So you'd fill this out, you'd give it to Megan as you leave, and then I'll be able to give you a call. On the bottom of this is also a link if you'd like to go ahead and schedule an appointment with me. You can do that by going online to Calendly. My link is right there. You'll be able to see my calendar. You can set up a phone appointment, an in-person appointment, or a Zoom call with me. So I'm here for you to answer questions even after our time together today. So even though we might have a little bit of gray hair, we still like to do some fun things. And we're here talking about United Healthcare, which is America's most chosen Medicare Advantage plan. So we'll be walking through some of the ins and outs of that. Who has some plans for over the holiday? Probably so, right? Halloween, we're already thinking about some things. We've got Veterans Day, we've got Thanksgiving coming in, we've got the Christmas holidays, Hanukkah, whatever you celebrate, New Year's Eve. Why don't we just go ahead and take care of all of the Medicare business today? Today is an enrollment meeting. If you are ready to enroll when we're done today, we are prepared to do that for you. All right? If you would like for us to check your doctors and your medications, we're prepared for that as well. There's a form that we have. You can give us your physician information, and you can fill in your medication information here. We can see if your physicians are in network. We can also check the pricing of your medications for you. Put your name on it so we can give you the form back. and your zip code so that we can look things up according to where you live. So you have that in front of you as well. When you're ready, if you haven't already given it to Megan, go ahead and just raise your hand and she'll come by and get that from you. All right? So let's get going. What are we going to be doing today? We're going to be talking about how you get started with Medicare. How do you figure out what's the right plan for you? We'll be walking through some of that. We'll talk about prescriptions. We'll talk about different times of the year that you can enroll in Medicare, some key information, and then again, how I can interact with you as your agent. So when we look at Medicare, we've got Medicare Part A and B. Part A is your hospitalization, and Part B is basically everything else. When we have A and B, that means that Medicare covers 80% of the cost. So there's a 20% that they don't cover when you have just this combination here. And we're going to talk a little bit more about that, how to preserve your assets, your income. A lot of people, Social Security is their only income, and we need to be able to preserve as much as we can. When we look at the different options, we basically have two options when we look at Medicare. You have your A and your B, so what do you do from there to be able to cover that 20% that's not covered? Well, you have option number one. You have a choice here to where you can add a supplemental program, a supplemental plan. And this is a non-government, it's a private insurance plan that actually covers the 20% that Medicare does not cover. That comes with a premium every single month. So you have to consider that as well, the premium, whether you use the plan or not. This is like eating off the a la carte side of a menu at a restaurant. You order the steak, but it doesn't come with the potato and it doesn't come with the salad, right? So you have to order that separately. The same thing would happen here. You would also want to cover yourself for your drugs, and you would have to add an additional drug plan at an additional cost. So that's option number one. Option number two is you can choose to combine your Part A and your Part B, and you can make that Part C, which is a Medicare Advantage plan, which most of them will come also with the drug plan, so you don't have the additional costs that you would have here. And many of them also come with additional benefits, your hearing, dental, vision, those types of things. So these are your options. What do you need to consider when you're thinking about this? Because there is a lot to consider, especially in today's environment and healthcare costs the way that they are. We're all very conscious of that. When you're looking at a Medicare Advantage, what are some of the questions you want to ask yourself? Do I want a lower monthly payment or no premium at all, and I just pay as I go? I want to make sure my doctors are in network, and that's the form that we have for you today, so we can check your doctors and all that before you leave. Are there any additional benefits that maybe original Medicare doesn't cover? And the plan, does it work with veterans benefits as well? So that's Medicare Advantage. If you're looking at Medicare supplemental insurance, you want to say, am I okay with a higher monthly premium in exchange for potentially no other cost after I pay that monthly premium? And do I want a national access to Medicare providers across the country? So those are the things you'd look at there. Additional drug coverage, what do I need to do there? Dual special needs, am I qualifying for Medicaid? And maybe I need to match up a Medicare Advantage plan to go with that? Or do I have some chronic special needs, diabetes, heart conditions, things like that, that may qualify me for some other things? So who's eligible? How do you enroll, right? So to be eligible, you have to be a U.S. citizen or legal residence here. Typically what happens, people that are 65 or older, that's the time that they're eligible, and some people will do it at 65 and others will wait until later if they're on a group plan. You could have a qualifying disability. You could be younger than 65 and qualify for Medicare. At any age, if you have end-stage renal disease getting dialysis, or ALS, which commonly we think about it as Lou Gehrig's disease, you would qualify at another time as well, much sooner than 65 if that's needed. So what are some of the times that we can enroll? So we're going to start with when we turn 65. I alluded to a moment ago that you don't necessarily have to do this if you're on a group employer plan. So what happens when you're on a group employer plan and it's considered creditable coverage, meaning that it's as good or better than Medicare, and your employer would be able to tell you that, you don't have to go on your Medicare. You can, but you don't have to. When you turn 65, if you don't have other coverage, you're going to want to meet this enrollment criteria. You have 7 months, 3 months before your 65th birthday, the month of your birth, and 3 months after, in order to eliminate any penalties that you might not want to have. If you miss this window, you could be exposed to penalties for not engaging your Medicare and your Part D. So you want to make sure that you're working with the broker and that you make sure that you meet these timelines. If you're going to be on a group plan, work with the broker so that you understand the implications when you're thinking about this. So what are some other times we can enroll? What is it now? It's annual enrollment, right? October the 15th through December the 7th is annual enrollment time. That's when anybody can make a change. They can have original Medicare, add Medicare Advantage. They could change a Medicare Advantage plan. They could come off of a supplement and go on a Medicare Advantage plan. There's all different types of things that can happen during this time of year. Then we have January through February. This is for people, maybe they missed this time period, or say that they made a change, or they kept a plan that they had, and they go to their doctor in January or February, and lo and behold, their doctor is no longer in network, and they want to be with their doctor. They have from January 1st through March 31st to make that change, to be able to align with their doctors. So that's a time that you can change your Medicare Advantage plan. You can drop everything altogether, just keep your A and B and have a drug plan. Then we have basically the rest of the year, and these are called special enrollment periods. So as you could see here, maybe someone's retired, maybe they're 67, they've decided to retire, so they're going to be losing their group coverage. They have a special enrollment opportunity. It's like they just turned 65, sort of. Maybe they moved out of the area, moving from Maricopa County to another county where their plan is no longer at, or to another state. Qualifying for what's called extra help. This means based on income. Maybe they qualify for assistance with some of their copays for medications, or maybe even this year, the starting threshold for our Part B premium that we have to pay whether we like it or not is $185 a month. So maybe they've changed and they now have that special election. They qualify for extra help from Medicare. Or maybe they now qualify for Medicaid and they can pair up a nice plan to work with their Medicaid plan so they can also get additional benefits. Or maybe they've been diagnosed with a qualifying disease, heart, diabetes, things like that, that they can qualify now for a Medicare plan. Let's talk about drugs. This is always a fun topic. So there are 3 payment stages for drugs. You'll see here there's an annual deductible. Medicare says that the insurance companies can charge us a deductible for our medications. Some do. Most do, some don't. It's $590. Some carriers, some insurance companies will just charge a portion of that. So once you meet that deductible, then you would go into your copays and your co-insurance phase here. Who knows the difference between copays and co-insurance? Yeah, about 98% of the people don't. So a copay, what that means when I say that is it's a flat dollar amount. So if I say this particular drug is $15 a month, that's a flat amount. If I say that a drug is going to cost you 32% of the cost. So maybe the cost is $1,000. So that's going to be $320. That's different than a copay. And hopefully the drug costs would come down, but that's not always the situation. Once you reach the threshold of $2,000 out of pocket, then you go to the catastrophic coverage, meaning you have no more drug costs for the rest of the year. The $2,000 cap and this having no cost after that is new for 2025, and I will tell you that it has saved a lot of Medicare beneficiaries a lot of money. So we were real happy to see that. So let's dig into this a little bit more. When we look at our out-of-pocket costs, remember a maximum of $2,000, we want to be able to stay in network with pharmacies that are in that plan. You can work with a preferred pharmacy network. That what that means is you may be able to save more money on your copays. You can also get your prescriptions via mail order, which potentially could save you more money on your copays. Each plan has its own formulary list predicated on the rules that they get from Medicare. So one plan may have a different formulary list than another. So that's why it's also important on that form that I gave you that we check your medications for you as well. How does it work? You can see here that there's tiers and how they classify drugs. So tier 1 are your preferred generics, your lisinopril, your atorvastatin, simvastatin, things like that we hear about a lot. Tier 2 generics, you won't have a copay typically for your preferred generic drugs. Tier 2, Tier 3, Tier 4, and 5, you start getting into copays or coinsurance. Tier 2 are your generics. Tier 3 are your preferred brand name drugs that the insurance companies work with. Tier 4 are non-preferred, so they're going to be a little more expensive. And Tier 5 specialty, that may be a percentage of that you would need to pay. Step therapy, what does that mean? So before we call the brain surgeon, we want to be able to make sure that we've done some things in the process. So maybe the doctor, and Repatha comes up a lot, so maybe the doctor right out of the gate wants to prescribe you Repatha. The insurance company says, well, doctor, let's see if we have, and you would want this as well, if we have some medications that cost a little bit less than the Repatha that would work. So they would have the doctor walk you through a step therapy process. And we'll talk about what happens if that doesn't work. Quantity limits, there's also some medications that have, maybe it's only 30 tablets a month, and you need 90. Your doctor would work with the insurance company to increase those quantity limits for you. Prior authorization. So when I talked about, don't call the brain surgeon before we get all of this done. So step therapy, they would be working with your insurance company, and if they found that you needed that higher cost drug, they would go through the prior authorization process for you to be able to get that drug or possibly a different drug that would be needed to help you. Formulary and utilization exceptions. So maybe you need a particular drug. I've had it happen with thyroid medications. A person might be allergic to something, a filler in the generic, so they've had to use the brand. That's where this has come into play as well. So your doctor is a key partner if there are specific medications that you need some changes on, or you need to increase quantity limits, things like that. There is a process for it. And what's nice is typically these decisions are made within about 72 hours. So it's not weeks and weeks and weeks. It's made quickly. And it can also be expedited if you have something going on with your health that needs to happen. Now we're going to walk into some of the fun stuff. So this is the Medicare Part C. This is a Medicare Advantage plan that United has that has extras. We call it the AZ5 here. And I want to showcase this one for you today. First of all, there's no monthly premium. So we all have to pay our Part B premium, right? Unless we're on Medicaid or we qualify for that level of extra help. So that doesn't change. But With this one, you would have no additional premium outside of that, okay? So that's a score there. $4,000 in dental. Who could use $4,000 in dental? Yes, I could right now. $4,000 in dental coverage dental services. I want you to know that United Healthcare, and working with them, has a very large network of dentists, and so we would check that with you as well. Who takes vitamins? Yep. How would you like $100 a quarter for vitamins, pain relievers, some of that ointment for an achy back, a blood pressure machine? There's all different types of things that you can use this for. That's $400 a year that you could get for that. It does not roll over, so if you don't use it in that quarter, use it or lose it. $300 allowance towards eyewear, and you also have an eye exam for a $0 copay. $300. These things are expensive. Free gym membership. They want us to stay healthy. So some of them in here are EOS, Planet Fitness, also the Rio Vista Community Center that a lot of people in this area love to go to. You can get your gym membership for free, and you can join the senior classes and so forth that they have there. They have a big program. No referrals in your local network. Now I'm going to give you a caveat on that. The plan does not require referrals. However, if we haven't gone to the primary care doctor and we want to go, let's go to the brain surgeon again, go straight to the brain surgeon. The brain surgeon is going to want us to have worked with our primary care doctor first, because there's screening and testing that can be done before we get there. So sometimes a specialist will require one. And I say that because I do get feedback from people like, you said no referral. Well, the plan doesn't require it, but a specialist may very well require it. The tier 1, the preferred generic drugs that we went over, those are at no cost, no copay. When you go to your primary care doctor, your regular doctor, maybe you go 2 or 3 times a year and that's it, there's no copay for that. So if that's what you did, no monthly premium, no copay to see your primary care doctor, okay? Copays as low as $99 for hearing aids. This is where you're going to hear about my Hospice of the Valley time. I meant to tell you also I am a social worker as well. So here's the thing. Untreated hearing loss is a predictor of a segue to dementia when you talk to some of the medical people. Doesn't mean everybody with hearing loss is going to get dementia, but it is a contributing factor. So get your hearing aids. Hearing aids with copays as low as $99. All right? So they're very affordable. And if you also participate in some other healthy activities, you can have additional rewards from United. So as your agent, what can I help you with? I can help you. We can look up your doctors. We can look up the specialists. We can look up your drugs. We can do all of that. We can plan your enrollment schedule. Like I said, today is an enrollment meeting, so we can do that today. If for some reason you don't qualify to do that today, you're going to be 65 in March, we can plan that process. Or you're going to be retiring at another time. We can look at the financial needs, because maybe you don't realize that you qualify for extra help from Medicare or potentially Medicaid. I've had that happen, and I help walk you through that. So understanding the Advantage program from United Healthcare and also how it works with veterans, we'll make sure that we walk through that individually with you as well. So why United Healthcare? Well, first of all, it's the number one, it's the most chosen Medicare Advantage plan in America. 4 out of 5 of the members would recommend these plans to their family and friends. 45 years of experience. You are not starting with a company that doesn't know what they are doing in the industry. And it has the largest national network in the country. So what does this mean to you? Probably some of you may leave for the summer and you come back for the winter time. Maybe you're here 6, 9, 10 months a year and this is your permanent residence. When you're out of the area, there's a very good possibility that there are doctors where you're going to be that are in network with United, and you can use your plan just as if you were living there. You can have a primary care doctor, you can have specialists. It's not a situation where you can only go to the ER or urgent care, as what happens with many plans. You can get your normal and usual care. You just call United when you're going to leave, and you let them know what you're doing, and they say, great, let us know when you're coming back. So it's very flexible for you across the country. It's in all the states except Alaska. Many states, it's the entire state. Some states, it's just certain counties that participate. And again, that's something as your broker, I would look that up for you. So Medicare coverage you can count on for your whole life ahead. So now what we're going to do, the people that would like to enroll, show of hands, will work with you to get that done. People that have some quick questions, we can answer those. And then if you would like for me to call you or make an appointment, remember, fill out this slip. And you can also go right online to my calendar, and you can set up a date and time that works best for you. So thank you all very much. Again, we greatly appreciate you being here today. And I'll be right back here for those that have questions. Thank you. We're good to go.